Dear colleague, hello, it's Dr. Jack. I'm here in my office and I want to tell you about the Child and Adolescent Master Psych Conference, or the CAMP Conference as we call it for short. Now the best way I can start is to ask you a couple of related questions. The first one is, when you think about satisfaction at work, what are the sources of that satisfaction? Is it working with particular patients, interacting with particular staff or colleagues, or simply the fact that you're doing good and you're helping people? Now conversely, what are the sources of stress for you at work? Think about it. Is it patients? Is it staff? Is it that the same problems keep cropping up over and over? Well, if you're like most people, there are probably several sources of both satisfaction and several sources of dissatisfaction and stress. So if stress is multifactorial, then I believe the solutions need to be multifactorial also. Now, the other part of the background of this is that stress and burnout are occurring at epidemic proportions in medicine more generally, including in psychiatry. 4 years ago, I surveyed attendees at a Master Psych conference, and I asked people to rate their level of stress. 49% rated it as moderate, and 19%, or nearly 1 in 5 people, rated it as so severe that they want to quit their jobs. So with that as background, I and my team here have been thinking about how do we build a better conference? And I want to tell you what our solution is. It's our 5-level model that we've incorporated into the CAMP conference. So at level 1, we address disorders and treatments. Now this is foundational for any psychiatric conference. We have to talk about the disorders that we treat our patients for. Major depressive disorder, anxiety disorders, disruptive mood dysregulation disorder, autism spectrum disorder, ADHD, and so forth. And of course, we have to talk about the treatments for those disorders. So even here, there's opportunities for improvement. So the editorial guidelines that our faculty must follow is, number one, the content that they provide us has to be up to date. It has to include references from the current year. It must be presented at a master level because, after all, we're not beginners. And third, it has to be detailed enough so that if there's a medication that you've never used, that you have enough details to actually use it safely and effectively. For instance, before you use a medication, you have to know, well, are there any assessments I need to complete before starting? What's a good target starting dose? Does it differ based on weight, on age? What's the target dose? Adverse effects, how do I manage them? What else do I need to monitor during the course of treatment? What about weaning off the treatment? What about monitoring things afterward? So in order to use a medication that you've never used, you really must have that level of detailed prescribing guidance. So that's what we present at level 1. Level 2, we look at the patient and the family unit more broadly. Because when you think about, areas of stress, they usually don't stem from, needing to decide, am I going to prescribe medication A versus medication B? It's usually the messiness of treating a patient and their family unit together, right? So patients and families, they may not keep appointments, they may not pay, they're not adherent with treatment. They come in, they're bickering. Pretty soon one parent turns to you and starts blaming you for the ineffectiveness of treatment. Then they're both ganging up on you. And then, heaven knows that divorced parents, they bring a whole nother level of complication to the picture. So, I'm sure you've had times, multiple times in your life where you thought, wow, if I could just treat my patients and not deal with their families, that would eliminate a lot of my stress. Well, yes, but we do have to deal with families. So that's why we have our faculty members look at case vignettes more holistically so that we can all feel more confident on addressing all those complications that go way beyond whatever diagnosis that the patient has and whatever treatments that we're prescribing. Now, at level 3, we look at things even more broadly, clinic procedures. Now, I know that doesn't sound like a very enticing or sexy topic, but it's actually very, very important. So when you think about, the sources of stress at work, you probably see that a lot of them are recurrent problems. Interactions with patients, with families, with staff, and they're recurrent. So if they're recurrent, that means they're predictable and foreseeable. So I'm going to be presenting you with actual scripts of like things to say to patients and families and staff in order to eliminate a lot of those recurrent problems, or the ones that do crop up, to nip them in the bud. So I'm going to give you scripts. I'm going to show you examples of what you may want to include in your treatment agreements, messaging on your website, what your receptionist should say to prospective patients or families that call you, what should be taken care of before the patient ever sees you. So we're going to go into actual word-by-word detail there. Level 4 looks at things even more broadly, where now we're looking at the clinician's career. Because the job that you have today, it's unlikely the job that you're going to have 5 or 10 years from now. So a career has a progression, early, middle, and late phase. And there's so many opportunities. There's a clinician shortage, especially in child and adolescent psychiatry. So you can almost choose any venue, any form of practice in any location in the United States or around the world that you choose. But you have to have information about those options, because really the work that you do really should align with your values and your life goals, and not simply because you're not aware of other options that might actually be much more aligned with what you want in your life. So that's what we cover at level 4. And at level 5, we look even more broadly at the clinician's well-being, because a lot of these sources of stress that begin at work, they spill over into our lives more broadly. They affect our relationships with family and with our partners, and they may affect our physical and our mental health. And so we need to look at those areas too. So we have a yoga instructor coming in. If you've never done yoga, this is an opportunity, really kind of like a stress-free way of introduction. And then if you like it, you can incorporate it into your lives. And then for me, I'm going to be presenting some guided imagery. I have personally found this to be very, very interesting and effective, and I want to share 2 or 3 of these guided imagery scenarios with you. So I really believe that because the sources of stress in our lives at work and outside of our work are multifactorial, our solution needs to be also. And that's why we have this 5-level model. So, problems often feed on each other, and they make us less and less resilient and more stressed. So we want to change those vicious cycles to virtuous cycles, so that beneficial changes in one area will support beneficial changes in another area. So that's our 5-level model. So please read the rest of this webpage to learn more about the conference. And I hope that you choose to join us. Now, you might be thinking, Jack, everything you're saying sounds pretty good, but how can a conference have such a big impact? Is this even the right venue for considering these topics? And I think that a conference is actually the perfect venue to look at these issues, life issues, issues of stress and of satisfaction, conversely. It's exactly the right venue to look at those bigger picture issues for the following reasons. First of all, there's plenty of faculty, specialists in their field that we can turn to for advice and guidance. We're surrounded by a lot of our colleagues. We can share stories, we can share advice, we can be supportive of each other. And by the way, when you come to the camp conference, you have access to the online community, so that we can support each other over the period of the entire next year. And then also, you know, when you attend a conference, you're away from home, you're away from work. You know, we're in a beautiful place where, you know, you can walk up and down a 10-mile beach. So it gives us an opportunity to look at the big picture, you know, to kind of lift our heads up and say, well, you know, I'm so stuck in the weeds dealing with these day-to-day problems. This is an opportunity to actually step back and think, what is it that I really want in my life? So that when I look back, when I'm an older person, and I can say, well, that was a life well lived. Not that every moment was filled with joy and happiness, but that, you know, I made the right decisions for myself. They really reflected my goals and my values. So I think a conference is actually a wonderful place to start thinking about these issues and to start implementing them too, and then continuing over a period of time. Now, I feel so strongly about this conference and the benefit that it can provide you that I want to take the risk, the financial risk, upon myself. So if for any reason, if you attend and you're not happy, you just don't think it's right for you, that I did not meet my promise to you, just ask for your money back. We have a better than money back guarantee. So I'd rather take some of that risk upon myself rather than risk someone who might benefit from coming, who chooses not to come because they're skeptical. Let me take that risk. Just please join us. Whatever you learn from it, it's yours to keep. It may kind of really change the direction that you're going to take in the rest of your life. So I think, you know, the potential benefits are great, and I want you to grab them. So please act soon before the conference sells out. I hope to see you there. It's Dr. Jack signing out for now. You take care of yourself. Thank you.